Hello everyone, welcome back to the UKMLA Roadmap series where we walk you through the MLA content map. Today we're going to talk about clinical hematology. To begin with, we have anemia, which is a very frequently tested topic in your multiple choice question exams and your OSCE stations. Make sure you do the major anemias like B12 and iron. Make sure you know all the causes of B12 and iron deficiency, and make sure you know how to interpret full blood counts and iron studies as well, and how to manage these patients. This topic has shown up in the past. It will show up in the future. Next, you have deep vein thrombosis. This is also very much a favorite topic. Make sure you do this well for your multiple choice question exams and your OSCE stations. Make sure you know all the causes of deep vein thrombosis and the associations. So COCP use, you have your travel history in an airplane, you have your surgical history with immobilization, you have your family history, all that good stuff, right? Make sure you know that in the context of deep vein thrombosis. Make sure you know how to examine this patient and how to manage them. Next, you have disseminated intravascular coagulation. This is something that I've seen show up more so in multiple choice question exams, not so much in your OSCE stations. May show up as an emergency scenario in your OSCE stations, but I would say that it's less of a chance that that will happen. There's less of a chance that that will happen. It will more so show up in your multiple choice question exams. Next, you have epistaxis. This shows up in your MCQs, of course, but also in your OSCE stations. Make sure you know how to manage this patient, all the causes of epistaxis, and how to give the patient advice on managing epistaxis when it does occur at home. Next, you have hemochromatosis. This shows up in multiple choice questions, but as an OSCE station, I haven't seen it show up as much, but make sure you look at the pictures of hemochromatosis, so the pigmentation that occurs, and pictures of eyes and pictures of the patient's skin, and how to manage this patient, and just make sure you do this well, because this may actually show up in your OSCEs, but it has more frequently shown up in MCQs. Next, you have hemoglobinopathies. So you've got your sickle cell, you've got your thalassemia. Shows up in multiple choice questions, of course, but in your OSCE stations, I've seen thalassemia show up as more of a genetic counseling scenario. So you have to explain to the patient that their child may get thalassemia if their partner is also a carrier, and sickle cell is similar to this. And yeah, so hemoglobinopathies do show up as OSCE stations. Next, you have, and they have been tested in the past. Next, you have hemophilia. This is something that, again, multiple choice questions, of course, but in the case of your OSCE stations, it may show up as a genetic counseling scenario, right? It may also show up as a scenario where you need to diagnose the patient, but that occurs, I'd say, a little less frequently. It's more of a scenario where you need to counsel the patient. Next, you have hyposplenism and splenectomy. I haven't seen a scenario of this show up in your OSCE stations, but I think this will show up in conjunction with some other conditions. So I think it won't show up in isolation. Maybe if it does show up in isolation, a patient has had a splenectomy, and then you have to counsel them and tell them about what is going to happen now and all the complications that may occur, or what they need to look out for because they've had a splenectomy. So yeah, but this is, I'd say, relatively new. Next, you have leukemia. Leukemia has shown up, again, multiple choice questions, OSCE stations. Leukemia does show up. Make sure you know how to interpret the labs and how to explain what this is to the patient. And yeah, you need to break bad news to the patient if they have leukemia. Next, you have lymphoma. Burkitt's lymphoma is a favorite, I would say, with Epstein-Barr virus infection. And just in general, you need to know about lymphomas. It does show up in MCQs and OSCE stations. It has shown up in the past, so these aren't new. Leukemia and lymphoma. Next, you have multiple myeloma. Multiple myeloma shows up in elderly patients. You've got your Bence-Jones proteins in the urine. That's more so an MCQ question, but in the case of your OSCE stations, you need to break the news to the patient. Back pain is a very pertinent or relevant feature. So make sure you know how to diagnose multiple myeloma. Make sure you look at the labs when it comes to multiple myeloma. So this has shown up in the past. Make sure you do it well. Myeloproliferative disorders, again, has shown up in the past. Make sure you do it well. for your OSCEs and your multiple choice question exams. Next, you have pancytopenia. Has shown up in the past as well. Make sure you know the causes of pancytopenia and how to investigate a patient with pancytopenia. Next, you have pathological fracture. Pathological fracture is something that does show up. I would say an elderly patient has a fall, maybe a child has some kind of disorder of the bones. So pathological fracture may show up in that case, in the case of OSCE stations. Also shows up in multiple choice questions, of course. Next you have, and again, this is something that has shown up in the past. Next you have patient on anticoagulant therapy. This is important. This shows up in surgical scenarios where you need to figure out how to adjust the patient's anticoagulation if they're undergoing surgery. The patient may have bleeding, so the patient may actually show up with epistaxis or bleeding from somewhere, and you need to adjust their anticoagulant dose. So yeah, anticoagulant therapy. Also, you might need to counsel a patient who is going to be started on anticoagulant therapy. So make sure you do this well, all the scenarios related to this. Next, you have patient on antiplatelet therapy. Similar to anticoagulant therapy, all the stuff that I've talked about. Next, you have polycythemia. So polycythemia may show up as polycythemia vera. Polycythemia as physiological polycythemia or pathological, shows up in multiple choice questions. Haven't seen it show up as much in OSCE stations, but it might show up. Okay, so make sure you know how to diagnose this patient, how to look at the labs of this patient, because you probably will be given the labs, and how to manage this patient. Next, you have pulmonary embolism. Very, very important. May show up as an emergency scenario, as a SIMMEN scenario, may show up as in, of course, it'll show up as a multiple choice question, but in your OSCE stations, this is very important. It will show up in some way or another. It is very likely that you will be tested on this, so just do this well. Next, you have sickle cell anemia. This is similar to the thalassemia station, where you need to counsel the patient on genetics, maybe. Also, this does sometimes show up as sickle cell crisis. So make sure you know how to identify sickle cell crisis and how to manage it. That is a scenario I have seen. Next, you have transfusion reactions, a very, very important SIMMEN or emergency scenario. This has shown up in the past. They'd love to test you on this, and make sure you do it well. And make sure you take a look at the presentations here as well. Okay, and yeah, so that's clinical hematology. Most of these topics have shown up in the past, and I wouldn't say that there's too much of an addition by the GMC in clinical hematology. These are tested topics, and just make sure you do these well. Okay, hope this helped. See you in the next video.